In this lesson, we're going to learn about how to safely reduce drugs consumption. When I say drugs, I refer specifically to blood sugar reducing drugs. This becomes more and more important as you will lower your blood sugar levels steadily and naturally using the lifestyle components that I told you earlier about, in which we're going to go deeper in the next modules. One of the most important drugs that are used in blood sugar control is metformin. So metformin is a pill. I mean, it comes in the forms of pills, and the usual doses are 500 milligrams or 850. Unfortunately, I cannot tell you how much these doses reduce your blood sugar levels because it greatly depends on individual factors such as weight, such as age, metabolic health, and so on. However, once you start reducing your blood sugar naturally, you will need to reduce the dose of metformin you're taking accordingly. Okay, so don't be hasty about it, just reduce it steadily and easily, because if you will continue to take metformin while your blood sugar levels are going lower and lower, you run into the risk of going into a hypoglycemia crisis, which I do not recommend and which we'll talk more about later on. But the thing is that you should steadily and easily dose off of it. Okay, one of the easiest things you can one of the easiest strategies that you can apply to achieve this is to try using only the 500 milligram dose, and afterwards reduce it from 3 times per day to maybe 2 times per day, even 1 time per day. Also, you may be able to try taking only half of pill at once instead of a full pill. This is again used to reduce blood sugar levels but have a lesser effect than usually. Again, to prevent your blood sugar levels to go too low. Okay? Next, insulin. This is a very, very well-known drug, so to speak. This is basically a hormone which our body produces as well, but in the case of individuals that have very high blood sugar levels or higher that could be controlled using only metformin or other drugs, usually the medical establishment suggests that you inject yourself with insulin. 1 unit of insulin shaves off usually 50 points off of your blood sugar. Okay, again, you should reduce the quantity of insulin accordingly with your blood sugar levels. Do this with caution and do not be overzealous with it. I cannot overemphasize this enough. What about other drugs? There are a lot of other drugs that are used to reduce blood sugar levels. Some are newer than others, some are more commercial, but to tell you the truth, it doesn't really matter. Okay, what you should do is you should get off of them steadily and easily and sustainably. Okay, the wisest thing to do would be to consult with your personal physician. Tell him about the program that you're going through. Tell him that you're trying to reduce your blood sugar levels naturally using nutrition, using exercise, and so on. Unfortunately, many doctors are not quite enthusiastic about it, so you'll probably be discouraged and you'll be advised against it. But nevertheless, because his mission is to help you, right? Nevertheless, ask him to assist you in reducing blood sugar, in reducing the dose of blood sugar reducing drugs. You should know that these drugs, although they may appear healthy or they may appear that they're doing only a good thing to your blood sugar, they do have many undesirable side effects while affecting your liver also. So over time, your liver can become overclogged with the toxins that are present in these drugs. I strongly suggest reducing other drugs as well. One of the most important drugs that are very recommended by all doctors in the case of diabetics is statins. But again, do consult with your personal physician. Tell him that you're going through a natural program that assists you to achieve the same results only through natural means, and establish a collaboration with him to get off these drugs safely and easily. The objective of diabetes reversal is normal blood sugar levels as soon as possible, even if for the moment we make some compromises, such as the use of drugs. So if your blood sugars levels are very high, like maybe over 200, it's natural and even recommended to use blood sugar reducing drugs, be it metformin, insulin, and others. But the thing is that even though they may be necessary in the beginning to control your blood sugar, you don't have to use them long term, okay? But nevertheless, do not consider them the enemy, okay? There are merely tools that are very necessary, that may be very necessary for you at the present moment. So please do not renounce them immediately, okay? Be very, very careful with this, because high blood sugar levels are very toxic to all the organs in your body. That's why it's imperative that you use these drugs to keep your blood sugar levels low until you can achieve the same results with by natural means. You can think of it as a cha-cha dance, okay, between blood sugar reducing drugs and your blood sugar levels. If you will implement the habits that I'm suggesting in this course, your blood sugar levels will go down slowly and surely. In the same time, you should reduce your blood sugar reducing drugs accordingly. So you can see that here it's a dance, it's a constant dance, okay, between your blood sugar levels and the drugs that you're using it to control it. It's very, very important to have patience. I cannot overemphasize this enough. Do not be hasty in reaching the goal of getting off all blood sugar reducing drugs as soon as possible. That is not the goal. I repeat, the goal of objective diabetes, the objective of diabetes reversal is achieving normal blood sugar levels, okay? Have patience, because even though in the beginning you may need blood sugar reducing drugs, they won't be necessary further along if you do the right things, which you learn about in this course. So always remember to tread with caution, and that the biggest danger in this endeavor is hypoglycemia, which we'll talk about in more length in a future model. But meantime, keep in mind that you should not force getting off blood sugar reducing drugs, and that you should reduce them accordingly, and most importantly, safely, while you're reducing your blood sugar levels naturally.